All right, a common complaint about not being able to sleep at night, believe it or not, is shoulder pain.
Interesting. Well, it's something that doctors at UCONN Health can treat both non-invasively or, if needed, surgically.
And we sent Melissa Cole there to learn about the best options for you. Take a look.
I see a lot of patients, young athletes, to grandparents and everyone in between.
Dr. Corey Dwyer, assistant professor of orthopedic surgery at UCONN Health, specializes in shoulder injuries. A common one he sees in his office is a rotator cuff tear.
The things I get concerned about for a rotator cuff tear is if you have pain on the outside of your shoulder, especially pain that wakes you up at night, or you're unable to lift the arm. You might have some clicks or some catches in moving your arm. So pain and weakness is obviously something that we would tell you to come in, be seen, and we would start probably with physical therapy first, unless we saw something really significant on your exam, then we would get the ball rolling quicker on that.
Dr. Dwyer often starts with non-operative methods first, like physical therapy and anti-inflammatory medications.
Thankfully here at UCONN, we have our PT and our imaging on the first floor. We have our ORs on the second floor, and our offices are on the third floor. So it's a one-stop shop here, which is really nice. And we work really closely with our physical therapists and our APRNs to initially see folks, and then if we think you're ready for surgery or that you need surgery, and then we have those options too.
In terms of surgery, there are options.
This is what you might hear of as total shoulder replacement. People also throw the word out there, anatomic total shoulder replacement. The reason why that is we replace the ball with a sphere, and we essentially clean up the socket and put a plastic liner. So that's a shoulder replacement. But actually what's more commonly done is some of our older patients, they might benefit from a reverse shoulder replacement. So you can see that we've changed the socket and placed a ball, and on the where the ball used to be, we now have a socket, so it doesn't have to rely on the rotator cuff tendons. So some of my older patients who have arthritis and I get worried about the rotator cuff will use this, or if they've had a really major rotator cuff injury, then this would be a better option so that they can actually start to use their arm pretty much right away. Honestly, these are some of my happiest patients. They haven't been able to use their arm for years. They have severe pain. It's really impacted their quality of life. And within a few weeks, they're actually, thankfully, they're quite happy.
And being part of UCONN Health is especially rewarding for Dr. Dwyer.
So as a graduate through undergrad and med school, I'm honored to be one of the team physicians for UCONN. But I don't treat just athletes. I take care of weekend warriors and grandparents and whatnot. So it's very rewarding to have a whole gamut full of patients and to help them out. It's been awesome. So I like to save a few minutes sometimes with some of my patients to talk shop about UCONN men's or women's basketball. So since we take pride in that, and those are actually some of my patients who I do shoulder replacements on. So it's really fun. So we don't treat just athletes, but it's an honor to be part of that.
Excited.
All right, so if you're dealing with a shoulder injury or pain and you would like more information, please visit health.uconn.edu.